Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle, and welcome to another episode and another edition of the Everything Medicare Podcast. Every single week, I bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. I hope you're doing well. I hope you're having a good week, and we are now in October. So, you know what that means. I've been saying it for the last couple of weeks now, and basically, folks, in the Medicare world, to which I work in and I'm highly associated with, I'm plugged in to what's going on in the scenes. And in the Medicare world, there's a tremendous amount of rules for people that do what I do. I run a brokerage, for those of you who don't know, and if this is your first time listening to me, where we work with all of the different available Medicare carriers to help people find the best fit based on their specific needs and preferences. We are not allowed to disclose any changes we know for the coming year. Now, the enrollment period is what I'm talking about, okay? The Medicare enrollment period is essentially here. Even though you can't make a change from October 15th through December 7th. The changes for the upcoming year in 2020 were made public on the 1st in your specific markets, specifically for Medicare Advantage plans and Medicare prescription drug plans. This really doesn't have anything to do with Medicare supplement plans like a Plan F, Plan G, Plan N, etc., etc., etc. So, the changes have been made public. So I have a whole lot of information that I'm going to be bringing you throughout the enrollment period as far as what is going on next year. Now that they're public knowledge, it's free to be disclosed, we can let it go. Now, a lot of this stuff, folks, we've known for a long time. You know, a lot of this stuff we've known since probably 5 months ago. Maybe 4 months ago. Some of it maybe we didn't find out until a couple of months ago. But this was information that I had. But because of the rules that Medicare kind of puts on me, we're not allowed to disclose any of this information until the 1st. But it's after the 1st now. And I've been dying to share this information with you. Okay. So I'm going to start out by telling you a little bit about kind of the topic we're talking about, okay? We're going to be talking about the Medicare donut hole, aka, in other words, the coverage gap. Now, if you're new to Medicare, you're new to this podcast, you may not be familiar with what the donut hole is, so let me explain. The donut hole, also known as the coverage gap in the Medicare world, is a stage of drug coverage. And I've done episodes in the past where we've specifically done detailed looks at the donut hole and the different stages of Medicare drug coverage as far as what they are, what they mean, how it works. But I'm going to break it down in a nutshell. In the Medicare world, for any type of Medicare plan that has prescription drug coverage included, this could be a Part D plan that goes with a Medicare supplement plan, since because Medicare supplements don't cover prescription drugs. This could be a Medicare Advantage plan that comes with prescription drug coverage. Now, not all Medicare Advantage plans cover prescription drugs. There's a few here and there that leave the drug coverage part out of it, but most Medicare Advantage plans you're going to see in most markets are going to cover prescription drugs. So any type of Medicare plan that covers prescription drug coverage has these stages of drug coverage. And this is a program, I'll have you, that is a government program. This really is not different from one insurance company or one product to another. This is a program that is determined by the federal government. And it's disgusted me for years. It's a horrible program that is designed to help everybody involved except for the people on the plans, and that is you. It's designed to help the insurance companies out. It's designed to help the pharmaceutical companies out, in my personal opinion. It has a horribly transparent agenda on what they're trying to do with these different stages of drug coverage. Let me first explain how it's worked in years past. Starting next year, in 2020, these stages were supposed to look quite a bit differently. But it looks like we're just going to have a lot more of the same. And I've known this for a while, and I've been heated about it for a while. I just couldn't say anything about it until the first. But it's after the first now. I can rant, I can riff, I can complain, I can whine, I can be outraged about it. Because this impacts every single person on Medicare in a negative way. Let me explain. In the past, the Medicare stages of drug coverage will look something like this. The first stage that a person would have on their Medicare drug plan, whether it come individually, whether they purchased it separately, or if they got it with a Medicare Advantage plan included, started like this. There was the deductible stage. If a plan had a deductible, usually you're probably looking at a couple $100. It could be probably as high as $415 or maybe $425. I can't remember the limit in 2019. Next year it will be a $435 limit for the deductibles, I believe. But if the plan had a deductible, it could be a maximum of what that amount, the $425 this year, $435 next year. But it could be less. It could be a $100 deductible, $200 deductible, $300 deductible, whatever that plan decides they wanted to charge for a deductible. Now, not all Medicare prescription drug plans have deductibles, so this stage will not apply to every plan. It's just if a plan has a deductible. And a lot of times these deductibles will apply to, a tier 3 through 5. So tiers 3, 4, and 5, and they wouldn't apply to tiers 1 and 2, but not on every plan. Some plans, they will apply to all tiers. If you're not familiar with what a tier is the category that, there are categories, that prescriptions are placed in with various insurance companies. And that determines the copay. The lower the tier, the lower the copay in that particular plan. And different insurance companies can take the same medication, the same prescription, and they can place it in different tiers. It's based on the insurance company's interpretation. They have tiers 1 through 5, 1 being the lowest, 5 being the highest. Tiers 1 and 2 are tier 1 being a preferred generic in the eyes of the insurance company, tier 2 being a non-preferred generic in the eyes of the insurance company. Tier 3 would be a preferred brand name in the eyes of the insurance company. Tier 4 would be a non-preferred brand name in the eyes of the insurance company. Tier 5 is known as a specialty prescription. Now, a prescription that is technically a generic of a popular brand name, let's say, could be categorized as a tier 3, meaning a brand name, by an insurance company, even if it's not a brand name. So please keep this in mind. But I digress. The first stage of Medicare prescription drug coverage is this deductible stage. If the plan that you're associated with has a deductible of any kind, and for whatever ways that it works, if it's for all prescriptions, it has to be met. For any prescription to be covered, if it's just for certain tiers, it has to be met for certain tiers. It just depends. But the deductible stage. So once that deductible is met, it's based on a calendar year. All of this is based on a calendar year. The next stage you have is what's known as the initial coverage stage. Now, this stage is what most people stay in. I'd say probably, if I had to guess, 60% of people or more. This is just an educated guess on my part. But if I had to guess, I'd say 60% of people stay in the initial coverage stage, and they don't go any farther than this. The initial coverage stage is what you're familiar with. You pay your copay for your medication. Let's say a medication costs $100 total cost. Let's say if there was no insurance involved. The insurance company pays $90 of it, you pay $10, that's your copay. That's the initial coverage stage. Simple, right? You have your copay, you pay your copay, the insurance company pays the rest. Now, the third stage of prescription drug coverage is what has been known this year and years before it as the donut hole, also known as the coverage gap. The donut hole or coverage gap basically works something like this. And this is one of the hardest things for people to understand and wrap their heads around when they first get onto Medicare, because it's confusing for a lot of people. But if I break it down in a proper manner, I believe that I can make it more digestible for you. The coverage gap, also known as the donut hole, as it's been commonly referred to as, is the third stage, like I mentioned, but it's basically determined by the total cost of your medications in a calendar year, meaning what you pay as well as what the insurance company pays. The total cost of your medication. So in my scenario earlier where I said there was a $100 medication, the insurance company paid $90, you paid $10. The total cost of the medication when it's ran through the insurance is totaled. And it's kept track of throughout the year by the insurance company. This year, it was under $4,000. I think it was $3,600, $3,700, somewhere in that ballpark. But once the total cost of your medications equaled whatever that total amount was throughout the calendar year, and it was a little bit different year in and year out, you would enter what's known as the donut hole, also known as the coverage gap. And the cost of your prescriptions would be reduced. This year in 2019, there was a 36 or 37%, I can't remember which, coinsurance for generic medications while you're in the donut hole / coverage gap. And you paid 25% of brand names. So as you can imagine, that cost was enormous for people. However, those numbers, those percentages have been a lot higher in years past. So the good news is that we have been moving in the right direction, because the lower those percentages are, the lower you pay. Because what you pay is based on the percentage that they're charging in the donut hole / coverage gap. So 25% of brand names, 36 or 37% of generics in the donut hole. So if you take a lot of medications, or if you know someone that takes a lot of medications, that can be devastating for a person. But there's a fourth, deductible, initial coverage gap, yes. There's a fourth stage of Medicare prescription drug coverage, and that is known as catastrophic coverage. Catastrophic coverage is basically the final stage. And that's based off of once you've paid a certain amount of money out of your pocket, and usually it's pretty exorbitant amount of money. It varies from year to year, but once you've paid a certain amount of money out of your pocket, usually about, depending on the year, $4,000 to $5,000, sometimes $6,000. It just depends on the year that you dealt with this in, if you've dealt with it in the past, because it's fluctuated from year to year. But once you've shelled out a tremendous amount of money out of your pocket for your medications in the calendar year, then you enter something that's called catastrophic coverage. And then your coverage is better than it ever was. You end up paying $1 or $2 for most medications, maybe $3, and you never would end up paying more than $7 or $8 for any medication, period. Okay. Now that sounds good, but what it takes to get there could bankrupt some people. So it's a horrible, awful program. And the last couple of years, it has been hyped up that this was going to change dramatically, that this whole system was going to be turned upside down, like they were going to have a completely new system coming out next year, that the donut hole would be no more. That's what we were told. Turns out, in my personal opinion, from where I'm sitting, from where I'm looking at this at, we've been lied to and deceived. Don't go anywhere. I'll talk about what this program will look like in 2020. Stay right with me.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare Advisor, not Christian Brindle, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
Welcome back, everybody. Thank you so much for sticking with me into our second segment. And I hope you enjoyed that message from Randy W. Hall, the Mr. Nice Guy Medicare Advisor. If you live in the states of Tennessee and Kentucky, I recommend you reach out to Randy and get help with your Medicare plan because, well, my organization's not licensed there. And Randy's a good quality agent. You need a good quality agent to work with. He can help you. Now let's keep this going into segment 2. So we talked about what the donut hole / coverage gap program has looked like for over a decade in segment 1. And the numbers have fluctuated. That's why I didn't go into exact details on it. But the numbers have fluctuated from year to year. You might have had, a different experience if you dealt with it one year. Maybe you had a year where you had to take a lot of medications, recovering from a surgery, or you had an illness or whatever, and you dealt with it one year, but you didn't deal with it the next. Or maybe you've dealt with it year after year after year. You've known somebody, you have a family member that's dealt with the donut hole / coverage gap year after year after year. But the numbers have fluctuated. So we've been told for a while now, a couple of years, that the donut hole was going to be no more in 2020. This was information that was being put out there by the Centers for Medicare and Medicaid Services, the government. Come to find out, in my opinion, I think it was bait and switch information. Let me explain what I mean. In 2020, the term donut hole will be taken off. The term donut hole. But it's still going to be called the coverage gap, and it still works exactly the same as it always has. It's baloney, folks. It's ridiculous. The coverage gap, it will no longer be known as the donut hole. That's the big news. It's no longer being known as the donut hole, but it's going to be exactly the same premise that it's always been. Now, it's going to be a little bit better next year, as it has been. But we were told that they were working on closing up the donut hole, and it was going to be closed by 2020, and nobody's talking about this. Only me. Only me. And I don't get it. We were told by various different organizations and Medicare directly that they were going to be closing the donut hole, that it was going to be closed by 2020. This was announced in 2015. This had something to do with the macro bill. Turns out, what they really meant was, guess what? We're going to keep this awful program that just takes advantage of seniors year after year after year. We're going to keep it exactly the same as it always has been. We're just going to take the name donut hole off of it because the name donut hole has a negative connotation. Yeah, that doesn't fix anything. This is what it's going to look like next year. It's going to be called the coverage gap only, which is no different. It's just it was the coverage gap / donut hole. Now it's not the donut hole anymore. Ooh, it doesn't do anything. It doesn't solve anything. But this is how it's going to work next year. I'll read it directly. After your total drug costs reach $4,020 in a calendar year, you will pay no more than 25% coinsurance for generics or 25% coinsurance for brand names. So, what's the difference? Well, the cost to get you in the donut hole is higher. It's over $4,000 now, whereas it was a little bit under $4,000 in 2019 and years prior. So it takes you a little bit longer to get into it, so that's a positive change. The coinsurance for generic prescriptions has gone from 36 or 37% of what you pay in the donut hole for generics down to 25%, so that's nice, but it's still 25% coinsurance for brand names. Is it improved going into next year? Yes. Am I upset about that part of it? No. What am I upset about? That we were lied to, that we were bamboozled for years. We had all of this to look forward to for years, and it turns out it was a complete lie, and it's just being swept under the carpet. Swept under the freaking carpet. This is a lie. This is straight up deceitful information that we were given. Complete sham, bamboozle. We were told that the coverage gap was going to be closed and it was going to be a different system. That it was going to be more friendly to the person on Medicare. It's good to know that some things never change, huh? I was so disappointed when I heard this information. I was disappointed for my clients. I was disappointed for people all over the country on Medicare, the millions upon millions of people that are impacted by the donut hole every single year. And I was disappointed that an outright lie, in my opinion, could be so easy. Stay with me into segment 3. I have some more final top thoughts I want to share with you on this. We'll wrap this up. Don't go anywhere. Welcome back, folks, to segment 3 of this episode of the Everything Medicare Podcast. If you're watching on YouTube, I apologize that this third segment is not on video. We're having some technical difficulties with our camera. Hopefully we have it fixed by the time we need to do the next episode. But we needed to get this episode finished and out for everybody that listens to this on audio, as well as wants to listen to the rest of it on audio on YouTube. So basically, folks, in summary, I'm incredibly disappointed by this news. Incredibly disappointed. And I can't believe that it's not being talked about more. That it's just being brushed under the rug, if you will. Also, some news that's probably important for you to know is the information for catastrophic coverage, which is the fourth and final segment, basically, if for any of you that might be listening that are affected in that regard. This is how catastrophic coverage is going to work. I'll read it to you. After your total out-of-pocket costs reach $6,350 a year, which is ridiculous. You have to pay that to get the catastrophic coverage. Over $6,000. You will pay the greater of $3.60 copay for a generic, including brand drugs treated as generics, or $8.95 copay for all of the drugs, or 5%, whichever one is greater. So, incredibly disappointed. I see no difference in the structure and how this is going to work going forward. No difference whatsoever. So in my opinion, I think we've all been kind of taken for a ride. And I might get in trouble for saying this, but someone has to. If I were you folks, I would write letters to your government officials. I would write letters to just show that this isn't okay. I think they somehow need to be held accountable for these actions. As always, folks, thank you so much for listening. I wish I had better news for you. I'm sorry that I don't. But I appreciate all of you listening, and I think together, we can work together to be put in a situation where we will be able to get the most out of your Medicare, to maximize it, to get everything out of it possible. And that's the purpose of this podcast. That is my intention always when we do these episodes. That's why we're doing 3 a week, even during our busiest time of the year. Trust me, it's not easy for us to do this 3 times a week. It's very difficult. But we will continue to do it because I care about you, my audience. And we want to be a source of constant information for you. As always, folks, thank you so much for listening. And during this enrollment period, if you'd like to talk with me about your Medicare plan and you live in the states of Utah, Florida, Idaho, and Oregon, again, that is Utah, Florida, Oregon, and Idaho, and you're just not sure if what you have is the best thing for you, I can talk with you about this. I can help you. My company is licensed in those 4 states, and we have one more coming that we should have any day now, and I will announce that as soon as we have more information about it. Just in time for the enrollment period as well. So I'm really, really excited for that announcement. But if you live in one of those states at the moment, Utah, Florida, Oregon, or Idaho, We work with all of the largest insurance companies in those markets. We can sort through the options, help you find the best available thing for you. If you're already on a plan, we can compare it with what's available and see if there's anything better for you. At the very least, folks, at least you can sleep better at night knowing that you have the best available thing for you. Peace of mind. That would be the worst case scenario, is that you can't do any better. Best case scenario is you can do a lot better. And we'd love the opportunity to be able to help you. So give my office a call during the enrollment period, which actually starts officially. You can make a change on October 15th, and that goes all the way through December 7th. My office's number is 801-255-5340, 801-255-5340. If you're more comfortable sending me an email directly, I'd love to talk with you on there as well. We have 24-hour turnaround time, on emails. My personal email is christianb@xmission.com, CHRISTIAN, B as in boy, at XMISSION.com, christianb@xmission.com. And folks, needless to say, I'm disappointed by this news. But we do have some more encouraging news to come in future episodes. So, watch for our episodes every Monday, Wednesday, and Saturday. If you enjoyed this episode and you enjoy what we're doing here and you want to support us, the best way you can do that is by leaving us a review if you're listening to us on a platform that allows you to do so of 5 stars, and writing something nice that you enjoy that we bring to the table. I hope you have a great day, and I can't wait to bring you another episode. And again, happy Medicare enrollment time. Talk with you soon.